when Typhoon Haiyan, locally called Yolanda, hit Philippines, there was massive destruction. The livelihoods of the population was disrupted, household food security and nutrition was affected, and the most vulnerable population are children under 5 years and pregnant and lactating mothers. In response to the humanitarian needs for typhoon-affected population, a strategic response plan was put together to support the government of Philippines in addressing the immediate needs of typhoon-affected population. In the strategic response plan, the objective 1 is to support typhoon-affected survivors to prevent nutrition deterioration, whereby we have to create access to nutrition services at community level. This gave rise to the community-based management of acute malnutrition approach that is globally used in emergencies and non-emergency contexts. Community-based management of acute malnutrition, called CMAM, as the name implies, is a community-based approach in managing acute malnourished cases, and in the Philippines, it has been adopted to a strategy called Philippine Integrated Management of Acute Malnutrition, PIMA. This strategy at the moment is in a draft form, but however, there is a memo from the Department of Health that partners should refer to this protocol in managing acute malnourished cases at community level. The community-based management of acute malnutrition, CMAM, has 4 major components. The first component is the community mobilization. This involves mobilizing the community in supporting the management of acute malnourished cases at community level. It involves nutrition screening of targets using mid-upper arm circumference or weight for height measurement tools. We also assess for nutritional edema. It goes further into case identification, appropriate and timely referrals to nutrition programs. The second is the Targeted Supplementary Feeding Program, TSFP for short. This nutrition program targets children with moderate acute malnutrition, MAM. Moderate acute malnutrition is a public health condition. The body becomes wasted and lacks nutrients and energy for normal body function. It is treated with one of the nutrition products referred to as Plumpy Soap. The third is the outpatient therapeutic program that targets children with severe acute malnutrition without clinical or medical complication. With severe acute malnutrition, the body is severely wasted. In addition to the lack of nutrients and energy, the body metabolism is lowered, the immune system is weakened, and the body organs impaired. Severe acute malnutrition is treated with the nutrition product referred to as Plumpy Nuts and routine medications, including amoxicillin.
I seek patients referred to me from the BHS who are severely malnourished. Initially, I evaluate the patient. If the patient has complications or infections, I give antibiotics. And if he has not received any deworming drug, I also give deworming drug and vitamin A. On top of that, we also give the Plumpy Nuts depending on the weight of the patient.
The fourth is called Inpatient Therapeutic Program, IDP. This targets children that are severely acutely malnourished but with clinical or medical complication. It requires medical personnel to stabilize the clinical complication, and then the nutrition therapy is being done by nutritionists or nutrition nurses.
This is the inpatient facility. It's located in Ormoc District Hospital that covers Ormoc City and all of the surrounding municipalities. The hospital provides medical therapy and International Medical Corps provides nutritional therapy. All services are provided free of charge. Hospital doctors and nurses regularly visit the patients in the inpatient facility to assess them, check their vital signs, and administer medications.
This is F75 milk. It is a therapeutic milk which we give to the children with severe acute malnutrition and clinical complication. This is the formula we start with, and they take it for like 3 days. It provides a total of about 750 kilocalories. That's the whole pack. And after 3 days, we move to F100. The clinical complication is a bit stabilized, and the F100 provides a total of about 1,000 kilocalories. The F100 doesn't have iron. This is ready-to-use therapeutic food or plumpy nut. We give the plumpy nut to children who have been rehabilitated in the inpatient facility and are about to go home. We test their appetite. When their appetite is good, based on their weight, we also give the exact quantity of plumpy nut required in order for them to gain weight, even when they proceed to the outpatient facility. All of the nutrition products used in the inpatient facility are provided by UNICEF, and we give a monthly report on the utilization of these commodities in the inpatient facility.
All patients admitted to the inpatient facility are accompanied by their caregiver. International Medical Corps provides the carers with food, transportation support, and infant and young child feeding counseling.
Ngingat kami sa health center kay screening sa bata din nahibalaan sa Samaritan Force nga na siya sa kanang malnourished siya nga naapod siya sakit. Samtang na ako dire gitudloan ko sa IMC nurse nga maghugas sa kamot before magpainom sa bata, then kinahanglan nga ang bata kanang ilingkod nimo kana og magpainom ka.
The community-based management of acute malnutrition strategy is being used globally, and there have been positive evidence in the use of this strategy in managing acute malnourished cases. Nutrition intervention cannot be done in silo. We need all other sectors to come on board in order to improve the nutritional status of children and pregnant and lactating women. We want to thank all partners in supporting International Medical Corps in moving forward